Hello and welcome to today's show. I am C. Virginia Fields, former Manhattan Borough President and currently President CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS. Back in 2019, after being an advocacy organization of a change agent for over 32 years, serving and working with African Americans throughout the country, the organization underwent a 2-year rebranding process. And coming out of that, the name was changed to the National Black Leadership Commission on Health, and we expanded our health focus areas from HIV and hepatitis C to include other health disparities that disproportionately impact Black African Americans. We continue to focus on HIV and hepatitis C, but also include cardiovascular disease, diabetes, prostate cancer, mental health, sickle cell, and we do work now in each one of those areas. We have a new mission. Our mission is to champion the promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. And the vision is to reduce disparities and achieve equity to promote the health and well-being of Black communities through education, advocacy, and policy. So with a new mission and a new vision, Black Health expanded its health focus areas, and we are now championing those areas to create Black health equity. This was a major development for the organization as we evolved through the years to become a more comprehensive advocacy, education, and policy group that, as I mentioned, moved beyond HIV, AIDS, and hepatitis C. Through our work, we recognize the intersectionality between HIV, AIDS, hepatitis C, and the other disparities that disproportionately impact Black African Americans. So today, we are excited to have a conversation about the comorbidities in obesity and diabetes from a health disparity, social determinants of health, and healthcare economic perspective. And I'm pleased to be joined today virtually by Dr. Maria Flowers, a diversity and health equity thought leader who is passionate about shaping future healthcare leaders and experts. She has over 20 years of experience working across diverse healthcare settings, consulting firms, and health systems. Dr. Flowers holds a doctorate of education, organizational change, and leadership from the University of Southern California, and a Master of Health Administration from the University of Phoenix. She is doing such phenomenal work, and I am so pleased and honored to welcome Dr. Flowers to our Manhattan Neighborhood Network show. And we do this monthly, Dr. Flowers, and I'm always excited about welcoming experts as well as members of my sorority, Alpha Kappa Alpha sorority. So welcome in that vein too. So why don't we get started with you talking somewhat about the work that you do and how you more or less, became involved and interested in this area. Welcome.
Yes. Well, first of all, let me say thank you, and I am honored to be here with you, Miss Virginia Fields. It's such a pleasure, and you've done such great work across your career, so it's just really a pleasure to be here. Um, so, as far as my work, I kind of have two avenues that I go down. I have a healthcare consulting firm called Maria D. Flowers and Associates, and we specialize in the organizational change and leadership aspect of health equity and patient safety. So, any health equity strategies and patient safety strategies, we work on that. We're also doing some work in your state, doing health equity impact assessments as well in the state of New York. So that is the for-profit side. I also started a nonprofit called Safer Healthcare for All. And the focus of that is patient advocacy, but more importantly, self advocacy, because I think it's important that minoritized patient populations understand how to advocate for themselves in the healthcare setting. So, those are the two avenues that I work in. I've been in healthcare for, like you said, over 20 years. I moved up the ranks. I started as a nuclear medicine technologist, and I moved up into corporate spaces. And my recent corporate experience is in patient safety and risk. And in that role, I experienced some things and saw some things that I wasn't pleased with. And that led me to my pursuit of my doctorate degree, where I did extensive research on how organizations perpetuate systemic racism in their healthcare practices. And that's what has fueled my passion.
That sounds very exciting, and I could feel the passion as you speak about the work that you do. What can you tell us about the current landscape of obesity, what many call an epidemic, or yes, an epidemic, not necessarily a pandemic yet, but an epidemic, and diabetes for health, I mean, for the Black community, because we hear a lot, and I would just say that here in the city of New York, for example, during the height of the COVID pandemic, we saw escalating rates of diabetes more than the national level. And we're working actively with the Department of Health in an effort to try to create policy as well as budgets allocated rather, to address this. So what can you tell us about the current landscape of obesity, again, what many call an epidemic, and diabetes for Black communities, and why is it important to have such a conversation from the perspective of comorbidities?
Yes, well, first of all, recent studies, even as recent as this year, have shown that obesity rates in African Americans are like 3 times higher than that of white Americans, and that Black women are have a greater propensity for obesity. And we know that obesity lends towards other comorbidities like diabetes, like cardiovascular disease, and other things that can show up in the body. And so, according to the Office of Minority Health, 4 out of 5, that's 4 out of 5 African American women are considered obese, meaning they have a body mass index or BMI over 30. And African American women have the highest, like I said, the highest rates of obesity within the United States. Um, these statistics are worse because they lead to hospitalizations and death with diabetes from end-stage renal disease. When diabetes isn't treated well, it leads to end-stage renal disease, which leads to need for kidney donation, dialysis, all of these things. And so these health disparities that are experienced by African Americans and African American women, more especially, they're exacerbated when these comorbidities exist, because we see more adverse healthcare outcomes, increased medical bills, and increased clinical care complexities.
And every time I am engaged in the level of discussions where certainly you talk about the statistics where 4 out of 5 Black women or seen based on a body mass are obese. And that we have these discussions, and the work that my organization is in, which the work my organization is engaged on the ground, educating, working with the community. We aren't seeing the kind of turnarounds that are needed. So in your work, what do you suggest we still need to do? Because it's just from observations, walking and passing and seeing people, it is so obvious. So what can we do differently than perhaps organizationally we're doing as community-based organizations, faith-based organizations, and elected officials?
Well, there's so much to unpack there as far as what can be done differently. I think there's kind of a misunderstanding when it comes to things like obesity, especially as it relates to African Americans, because we tend to think, well, just go on ahead and do, exercise, or, get your diet together, or do this. And then it's a little more complex than this, because a lot of the time, the epigenetics, meaning the trauma, the things that have been passed down intergenerationally, can impact how we metabolically process stress, and that can lead to obesity. So it's not just, oh well, I'm in shape and I run and I do this and I do that. It's more than that. And so I think that to answer that question in a deeper way, I think that the impact of systemic racism and structural racism are not emphasized enough when discussing health, especially in relation to African Americans and other minoritized populations, because that in itself plays a larger factor than some people may believe. Yes, there are things we can do. Yes, we should exercise. Yes, we should move more. But there is a stress component of perceived and experienced discrimination that tends to lead towards obesity.
Yeah, we often hear the phrase, when we know better, we will do better. And you mentioned about systemic racism and structural barriers, how that often keeps us from doing better. It's not all genetics, it's not all environmental, but we're not hitting the mark in terms of what the discussions should be, and how our communities can be transformed, just even in terms of moving from food deserts and having appropriate and good food and fruits and vegetables in our communities. I mean, I see that happening so often, even in the community in which I live here in Central Harlem. So speaking from the perspective of structural barriers, just dive in a little more on that in terms of what you're seeing, and perhaps how that can lead to some legislative and policy changes.
Yeah, so when you talk about structural barriers, there's a term called social determinants of health. So it's issues like, where you work, live, play, and age that impact your health. And yes, these things have an impact on obesity. So you'll see in that with systemic racism, structural barriers can impact your access to health, but not just that. It can impact your access to, as you said, food, to the type of housing or the type of neighborhood that you're able to live in, the level of education you're able to attain to, the employment, which will impact your economic situation. And so all of those things are tied together. So when you're looking at driving policy towards changing these things, you can't just look at it from a healthcare perspective. You have to look at all the root causes, all the underlying issues, those social determinants of health. Some people refer to them as political determinants of health that can impact the way one's well-being is.
Absolutely. And you touched upon a very important area that we're certainly focused a lot on, and that is the political determinants of health. Because until we change some policies, we will continue to work at the community level and we'll just continue to see the same things over and over again. Are you working a lot? I know you mentioned women, but what about children and young people? I'm often told, and I understand it, that it's not politically correct to say these are fat children. I get that. But at the same time, the observation is that there are serious issues of obesity among our young people. And I'm not hearing enough about how we need to, how we're addressing it. So can you speak a little about what you know about what is happening with young people? Because we have youth empowerment programs that we're trying to reach more young people.
Sure. Before I get into that, I want to bring up, you mentioned political determinants of health, and there's a great book out by Daniel Dawes that is of that same name, Political Determinants of Health, and it talks about a deep dive into all the policy changes that are needed to fix some of these upstream conditions. But when we talk about children, you know, there's so much there. I mean, there's a lot of things that have been put in place, policies as far as public school and physical education, and the dietary, the food that is provided for children in the public school setting. That is a area that needs to be addressed. There was recently something online showing what, like an average meal that they give in the public school setting. Not to say that all schools provide these same kind of meals, but it was like a bag of chips and some nacho cheese and something. These are not nutritious foods. And the food that we intake, and I have a 9-year-old son, and I have this conversation with my son a lot. He wants to go out to eat, and that was a luxury when we were growing up. That wasn't commonplace. We cooked at home. You ate what was there, and and that was it. But a lot of the foods now are genetically modified, and this has just happened within my generation, so we don't know the impact of that. There are some scientific studies about how these hormones and things that have been pumped into the meat and all of this can impact our children. But it's known that the food in the United States contains preservatives and sugar contents that are illegal in other countries. So there needs to be a stronger push, not just for our children and our next generation, but just globally. There needs to be a stronger push to restrict the corporations from producing these food products, and federal incentives for those that are able to grow their own fruits and vegetables at home. And this will help our children get the nutrition that they need instead of being fed these foods that don't have much of a nutritional value.
Yeah, I see a lot more information about gardens and programs where young people are being encouraged to participate in these programs. But I would say here in New York City, it really used to be a very major initiative, but a lot of the community gardens now have been displaced with housing or other uses for public uses like parking or police cars in certain areas of the precinct. So we're not even doing as much in those areas as we were doing in the past. And I think that speaks to community engagement and involvement more that we need to be talking about and doing more about. So in your role now, are you engaged in I would say not lobbying so much, but advocating with elected representatives as it relates to needed legislation and policy changes?
Yes. So, and you can use lobbying, because
Okay.
that's what it is,
Okay.
and that's what the corporations do. A lot of people don't know. A lot of the for-profit and even some of the nonprofit healthcare organizations, they have representatives that go to DC and lobby for their case. And so, yes, we need to lobby for our own. You mentioned community engagement, and I think that is so key for the advocacy slash lobbying, because depending on your community makeup, your community needs are going to differ, and that is the voice. That's where we need to start with what is needed. And so, in my work through Safer Healthcare for All, I do collaborate with some, I will just say, political action groups that emphasize community engagement and emphasize the promotion of health equity. And I, lend my advice on, policy recommendations on what needs to take place here in Tennessee. One of the major issues that we're seeing after COVID, a lot of people have lost their Medicare coverage, their state health coverage, because it was extended and it was given because of COVID. It kept, a lot of people were given access so they can get a treatment. And just this, I think it was in April or May of this year, that was taken away. Well, that's a huge public health issue, because now you have a large subset of the population that doesn't have access to health. So there's some things that we're doing on that end as well, as far as educating just the general public on what they can do to continue their coverage, which avenues, what options they have available to continue their health care coverage so they can get the coverage and the care that they need.
And I'm glad you mentioned that, because we are also seeing that around the country in terms of Medicare, not Medicaid, rather, not families not being eligible for that anymore. And we know the value that it provides. So that's a very important area to keep advocating and lobbying to bring about the changes at the state level and the federal level that is needed. But I don't know about you, but I'm finding that in this climate, political climate that we're in now, it is so hard to break through on these important issues, whether it's maternal health, whether it is diabetes, obesity at the federal, the state, and the local levels. Finding it really harder to break through. We can't give up. We have to keep moving forward. But is that part of what you're also experiencing or seeing?
Yeah, I think that's a blanket issue right now, especially after that decision, that Supreme Court decision in that impacted education, as far as diversity is included. But that decision now has grown some legs, and other areas. California has some really good legislation about the type of education that physicians and healthcare workers need for implicit bias, cultural competency, and perinatal care coverage, and that's being challenged right now. So everything is under attack right now, as far as anything with the word equity in it, whether it's health equity, whether educational equity, diversity, equity, inclusion. It is under attack right now, and it seems to be an agenda to set us back, 60, 70 years, and we have to fight against that. And that's what I'm doing in the organizations that I oversee from both ends. I like to look at it, I work it from the top down and I work it from the bottom up, because both areas need to be worked so that there can be a meeting in the middle. But there's a lot of work that needs to be done, and it can get exhausting. But like you said, we have to continue to fight.
Oh, it can definitely be exhausting, and we see that in the work that we do, and especially as we're on the ground and doing the education part. Just from HIV alone, we think that more people are aware and how to prevent becoming infected or impacted by HIV. But it's amazing the number of people who will say to staff as they do their outreach work, oh, we thought HIV was over. That is not a problem anymore. But when you think about how it is transmitted is not going to be over unless you are exercising certain, precautions and understanding some of the prevention, such as PrEP. And we're finding that in the Black community, as I'm sure you know, that the uptake of PrEP is the lowest among Black, gay, and bisexual men in our community. So there's a lot of work to be done in all of these areas. So what can you tell us about next steps? What do we need to do? What do we need to think about? Where do we need to go? And something about maybe coalitions around this, because I think these are the kind of issues that coalitions are incredibly important.
Yeah, well, one thing that is so important, and what I emphasize in my work with Safer Healthcare for All, is empowering the voice of the patient. And who's the patient? That's everybody. That's me, that's you, that's everyone. We're all patients because we all need healthcare. One thing that New York is doing really well that I really like, there was some new legislation passed, the Health Equity Impact Assessments, and these are assessments that the hospitals and healthcare facilities in your state need to do when they need to do like a capital, funding project, or there's a merger and acquisition, or anything that needs a certificate of need. This is important because part of that legislation requires meaningful community engagement, and that's your opportunity. So when you see these announcements or hospitals are doing things in that area, that's the opportunity for the community, which is you and people that those hospitals and medical facilities serve, to be able to have a voice and to insert their opinion in those decisions.
Okay, thank you. And that's a great ending to our wonderful conversation, Dr. Flowers. I'm so happy that you were able to join us, and we hope to get back to you because this subject is not going to go away, or I should say the health-related issue to it is not going to go away. And so we would like to thank you, Dr. Maria Flowers, for joining us today. And we still have a way to go, as you have pointed out. But I believe that by being informed, staying informed, doing the work within our homes, our communities, holding policymakers accountable, we will be able to move forward and move the needle. So for more information about the community programs that you've heard talked about today and the work of Dr. Flowers, please visit ndlch.org for more information about the exciting work going on and the broadcasts today. And I'm pleased to say that the Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, your friends, and your neighbors know about this programming. And again, I am C. Virginia Fields, and I thank you for joining me and hope that you'll tune in next time for Health Action Network here on Manhattan Neighborhood Network. And again, thanks to Dr. Flowers.
And thank you so much for having me, Miss Virginia Fields. It was a pleasure.